Hi, you are in the ladies' room with Dr. Donnica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donnica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donnica. Now, I have a question for everybody today. Are you sick or sick and tired of false information, otherwise known as lies, circulating in the news media and social media about, no, we're not talking about politics, but about important health topics on everything from COVID-19 to vaccines, to what we should eat, to even what underwear we should wear? Well, so am I. And so is today's guest, Dr. Nina Shapiro, a graduate of Harvard Medical School. She's the director of pediatric ear, nose, and throat at the Mattel Children's Hospital, UCLA, and professor of head and neck surgery at the David Geffen School of Medicine at UCLA also. With more than 2 decades of experience in clinical and academic medicine, she's a trusted expert to whom her patients and the media rely on to set the record straight about some of the latest health fads and misconceptions. And yes, Gwyneth Paltrow, I hope you're listening. Her trademark wisdom and no-nonsense attitude is accessible to readers everywhere in her book, Hype, A Doctor's Guide to Medical Myths, Exaggerated Claims, and Bad Advice, How to Tell What's Real and What's Not. And of course, I loved the title, so I had to invite her here when we sort of met on Twitter. Hype was published in 2018 and was listed as a best lifestyle book in Publishers Weekly Best Books of 2018. Dr. Shapiro, welcome to the Ladies' Room.
Thank you so much for having me. Great to be here.
Oh, it's such a pleasure. So what gave you the idea for the book?
So I think the book came about over years of working in Los Angeles, taking care of patients and families who live in Los Angeles, and also being a mom and a person who has friends and family, and really just over the years hearing these questions or concerns that seemed really important, but oftentimes misguided. So I felt that I really needed to work on a book where people can learn to navigate all of these issues that come at us on a daily basis, really every minute online, primarily as far as our health, and how to really understand how to answer those questions.
So I was actually thinking of writing a similar book in 2000 called Debunking the Myths, which is actually a section on my website and has been since 2000. And I remember talking to a publisher who said, oh, people wouldn't understand what the word debunking means. And, I just decided to just keep it on my website. Did you find that writing the book actually increased the number of questions you got or decreased the number of questions you got?
Oh, definitely increased. And I think, people think of it as in a couple of ways. One is just the broad information as far as health. And then I would say more commonly, people think about, what about me? What about my family and my health? So I feel like whenever I would do events, the questions would oftentimes become narrower and narrower, more focused on, well, I take ginger for this, or I take turmeric for this. What do you think about that for my diabetes or my high blood pressure? So I feel like in some ways the questions increased. And sometimes people would have really challenging questions that I wouldn't have answers to, certainly plenty of those, but definitely more questions as the book became read.
Well, one of the things I find, and I had the same experience with doing speaking events and occasions, and also through the website, people sending me lots of questions over the years. And now actually been 2 decades since we've had drdonnica.com. But I find that a lot of the questions are very similar. So what I used to say at events is I was happy to stay and answer all the questions that time would permit, but that I could predict about 50% of the questions. And about 25% of the questions were kind of, common, but not super predictable. And then there was always one person who came up with one question that I never heard of or never thought of in a million years. Did you ever get that question?
There have been some really odd questions over the years, or few years that I've been sort of in the public eye for this? And, some of them are just sort of where did that come from? Or I'd never heard of that, or, a disorder I'd never heard of, or a treatment that I've never heard of. So certainly there were plenty, or they would use something that was, certainly well out of the realm of what it was supposed to be used for. So there was oftentimes that moment of, what in the world did I just hear?
Does any one question jump to mind as particularly just baffling or befuddling?
Well, I think a lot of them were related to using herbs or spices, or I mentioned ginger or turmeric, or for all these issues that didn't necessarily have any connection to the other.
Mm-hmm.
So there was definitely a lot of bizarre head scratching, like, wait, what did you just say?
Wait, what? So for those questions, I have certain rules or certain phrases that I often throw out. And let's play a game where I'll tell you mine and you can tell me yours, because I'm sure you have certain ways and sayings. They're kind of like mommyisms, where where you just kind of say the same answer for, every one of a question in a certain category. So one of the things, so if I get the questions about ginger and turmeric and, for helping treat diabetes or other inflammatory processes or any of those things, my first answer is I never argue with someone who says something works for them. That's number one. So what's your number one answer for those kinds of things?
For those, it depends. If they're phrasing it like a question, and I have no idea where this is coming from except left field, I'll usually just say, that is a really interesting question, to sort of put it on them, that is really interesting. And then, it's similar. I wouldn't necessarily always say if it works for you, but certainly that is something to keep in mind for them. But, I would also be very, very upfront with saying, I have never heard that before. That doesn't mean that it doesn't exist, or it's not good, or it's not helpful for you. But that's a really interesting question. And I will look into that. I sort of leave it open-ended because I don't want to just shut it down, because some of this stuff is there's probably a grain of truth.
But some of the stuff you might look into, but some of the stuff you're never going to look into.
Yeah.
The most bizarre question I ever had that turned out to be a thing was about endometriosis of the lung. And I had never heard of that despite training in OBGYN. I did look it up, and it turns out there were 3 documented cases in history.
Okay.
So what I very often say is, just because I haven't heard of it doesn't mean it's not a thing. My favorite response, of course, is, that's a really good question and something you should talk to your own personal physician about.
Yeah.
Because I can't give you personal medical information, or sometimes I say I can't give you personal information, medical advice, unless you lie down and have your pelvic exam right here. But there have been times too when I've gotten questions in those circumstances where, because I was only hearing one tip of the iceberg, I was able to actually figure out the problem, whereas the patient's doctor was not able to figure out the problem because it was so overwhelming. Can you think of any examples where that ever happened to you?
I think sometimes, and again, it depends on the venue. I remember a couple of times there have been people who focused on, well, I went to this doctor and I didn't like the way they, for surgical opinion, let's say, I didn't like the way we interacted, so I went for a second opinion. I didn't like them. I went for a third opinion. I didn't like them. And, you start to get the sense of, everybody's bad. So, that has been a time where I can say, well, let's think about what the issue is and why the issue is with all of these doctors that you're seeing, that there's a bad connection between the two of you. And maybe that's their, issue, the doctor's issue, or maybe it's your issue, and maybe a little bit of both. So, I have helped patients, even these are strangers, basically navigate how to find a good consultant or practitioner, so they can, think about it when they, before they go, as opposed to just being disappointed each time, to really understand what's disappointing them, what they're looking for, what answers they're really not getting, and, to sort of come armed with their questions as opposed to just showing up and expecting people to figure it out. So, that's been something that I think has been helpful, because people just are, sometimes they have that a little bit of passive sense that I'm here, figure out my problem, and then they end up disappointed. So I, just sort of teaching people how to prepare themselves when they go for a visit.
Well, I think they don't understand also that if we don't have all of the information, we can't make a thorough assessment. And sometimes that critical piece of information is just one little thing that somebody forgot to mention. So the example that always jumps to my mind is I gave a talk once on menopause, and I just threw in there this fun fact that I had recently learned or read, that, of course, when we talk about menopause, we also talk about premature menopause or premature ovarian failure, which is menopause for any reason under 40. And the average age at that time, I haven't looked it up recently, was 27. And so I had a long list of people waiting to ask me questions afterwards. And finally I get to this one young woman who had tears in her eyes, and all she could say was, "I'm 27." And she had been trying to get pregnant, and nobody had made the diagnosis of premature ovarian failure.
Wow.
And similarly, I had another woman who once said she was trying to get pregnant, and she went to all these infertility doctors and whatever. And I asked her what medicines she was taking. And she tells me all her medicines and didn't know the names of most of the medicines. And she said she was taking a medicine for an ovarian cyst. And as you know, there aren't a lot of medicines for ovarian cysts. But I said, "Do you know the name?" "No." "Do you have it on you?" "Yes." And she pulls out a package of birth control pills. So one of her doctors put her on birth control pills for the treatment of an ovarian cyst, which is correct, unless somebody's trying to get pregnant.
Right.
And she didn't mention that to the 3 different infertility doctors, she said. All right. So anyway, so tell us more about hype. So I'm so hyped about just the title.
Thank you. Yes, I really, really wanted that title. And I think that was also the year of the one-word titles. There were a lot of years that had one word. So everyone was very set on that. So what it is it's the point about hype is that things are not necessarily all right or all wrong. And a lot of the quote unquote false information or fake information that we hear often has a little bit of value to it or a little bit of truth. It's just exaggerated and blown up and expanded into this, hyperbole of whatever is expanded in this information. So the hype idea is that there's always that sweet spot of what's really important and valid and evidence-based in medicine. And then a lot of the other stuff is either fluff, which isn't necessarily bad, or really bad, or somewhere in the middle. So I think the reason about, the point of hype is that, as I said, you really want to be able to tease out and navigate your health journey or your family's health journey in a way that is based on science and evidence and reality, as opposed to, some big post that you read on Facebook or Twitter or Instagram or whatever, that you don't necessarily hang on to that, and that you really understand what you're saying and why. So I sort of think of it as a tool, because even though it was written in 2018,
which was so long ago, that feels like it was about 24 years ago.
Right. Like 2020 was so long ago. But it still applies today, because a lot of the information isn't necessarily, about the measles vaccine as opposed to the COVID vaccine. It's how do you discern, the data in a way that even if you're not a medical person, you can make a good decision and an educated decision about health choices.
On the other hand, despite the fact that I am a physician, as a mother, I did not feel obligated to read all the data on vaccines. I did not feel like I needed all the information in order to make a decision. And I think that's one of the other things we have to let people know is at some point you trust your physician, or your pediatrician, your children's physician. And at some point you say, well, I do know that polio is really, really, really bad. And measles is really, really, really bad. And maybe if 13 people in the whole country had allergic reactions because they might have been allergic to eggs, maybe the odds of that happening in my children's case is really not a reality. It's funny you mentioned COVID vaccine. I recently had mine. Have you been vaccinated? Twice. I'm only once so far. But I symbolically had the technician aim for right below my smallpox vaccine scar.
Me too.
Yeah, because I felt like that was full circle, smallpox to COVID. Have you thought about writing a new edition of the book, since it was written 24 years ago, and including a chapter on COVID?
I would love to. I think that, obviously there are as many days as we've been in COVID, I think 311 plus, there have been books, pitched about COVID. But I would love to, there is actually a paperback version of Hype coming out. Unfortunately, it will be the same version as the hardcover. But I would love to do an additional COVID chapter or section, because I think there's so much to it. And, the important thing about COVID is that what we write now is going to be different when it gets published 6 or 18 months from now.
Right.
So that's the interesting thing about COVID. We don't have, the vaccine data is evolving as we're giving vaccines and getting vaccines. Although we have the initial huge group of patients who've gotten the vaccines, do we know how long the vaccine lasts, for instance? We don't, because it's only been out for less than a year. Do we know, really what the percentages are going to be when we're talking about millions and hopefully billions of patients? We don't know, because it hasn't happened yet. Do we know how long the long haulers are going to be long haulers? Is it going to be 6 months or 6 years? We don't know that. But I think it is really important to write it as it's happening, because it's a fascinating, if you take away the horror and the death and the tragedy and the morbidity, it's a fascinating process that we're going through.
Right. And one thing we have to be very mindful of is not taking away the horror and the morbidity and the mortality. Right. Because as we're speaking, we are on the verge of 400,000 Americans being dead from this disease. And the long haulers, as they are somewhat flippantly known, are people who have chronic illness from COVID and from coronavirus. And we don't know even if that's a continuation of the disease or if that is a post-viral syndrome akin to post-viral syndromes seen in many viral infections, including polio, and even AIDS has a post-viral syndrome. And many people think that might be chronic fatigue syndrome caused by those viruses. So, still lots and lots of questions to ask. So I know you have some fun hype things in your book. What was your favorite to write about?
I really liked writing about risk, actually. It's because it's something, there's a lot of tangible in the book. So there's diet, there's exercise, there's vaccines, there's medications, there's medical surgical workups. But risk is something that we live through every second of our life, but we don't think about it. And then once we think about it, it's really amazing that we can get through our days and that we survive life as we know it without COVID. So I really enjoyed that, because it really makes me as a writer and the reader think about things in a different way. And so the obvious would be, car accidents. That's sort of a basic thing that everyone thinks about when they think about risk, getting into a car, putting your seatbelt on, having airbags, not driving under the influence. So that's obvious. But then there are other things.
Although not obvious to all the people who don't do it.
That, but as far as considering that a risk, but there's so many other sort of subtle risks that we don't necessarily, walking down the sidewalk, we don't think about that.
A friend of mine from college was literally just killed walking down the sidewalk in Manhattan. She was 60 years old and a brilliant, accomplished architect, mother of 3, and she was hit by the facade of a piece of the facade of a building that broke off.
The Princeton grad.
Yes.
I read about that.
Yes.
Oh, tragic. I read about
that. Erica Lindenbaum, may she rest in peace. Yeah. And it was just pretty shocking.
Crazy. I mean, you can't make that up. That was just so tragic. I remember that.
And another friend of mine, who's a physician, an internist, was walking his dog in broad daylight on a street of suburban New Jersey, and he got hit by a drunk driver on the sidewalk, and the dog was killed, and he survived but lost his leg. And he survived but was in a trauma center for months and months. So I think that's what we don't see in statistics is the survivors who take them months and months and months and millions of dollars of expenses, to get to where they are. One of the things I often say about risk is if it happens to you, the incidence is 100%.
Right.
Yeah. So what do you want people to know about risk?
I think that, when you think you're being careful or you think you're being safe, and oftentimes that is when reflected in a health decision, that the other side of it, which may seem quote unquote invasive or too extreme, is actually potentially less risky than not doing something. So omitting something which you think isn't necessarily, certainly from a surgical, or, you're a surgeon as well, people will think like, well, I don't want to have a C-section because that's high risk. But the risk of a vaginal delivery for X, Y, and Z situations is higher risk. Mm-hmm. So, when we think of surgery, we always think of that as the riskiest, but very oftentimes not doing surgery or not having an intervention can be higher risk than the intervention itself. So
and if you talk to most women OBGYNs, most of us, more of us than not, had C-sections ourselves. And there's been no good study that I've seen about why that is. But of course we could guess that women physicians in general and OBGYNs in particular tend to be older when we have our children. So right off the bat, but also it's because we tend to be less afraid of making that decision. And we feel more comfortable with making the decision to have a C-section than a less certain outcome.
I think female urologists, they all have C-sections.
All 14 of them. Actually, I think they're about, I want to say 6. No, I'm not going to guess the number because I may be wrong, but we have had 2 female urologists as guests in the ladies' room so far. But in OBGYN, we call C-sections vaginal bypass surgery.
Right.
And I had one by choice and one not by choice. So, and it was a wonderful way to have the other way around. The first one was not by choice. The second one was by choice. And the second one was a wonderful way to have a baby. Dr. Smith, your 9 o'clock is here. My hair was done. My nails were done. Everything was ready, smooth. Yep. No problem. The recovery was not so fun.
Right. But, I think it's still in many cases safer, especially if you've had C-section the first time. I mean, a VBAC is not without risk. It's a high.
And a VBAC, of course, is a vaginal birth after cesarean. And that's one of the things that there's lots of conflicting data about whether you have to have that or whether you should have that or not have that. And I went all the way. I had my cesarean with general anesthesia. So
wow.
Out for the count. And that is a lovely way to have a baby. And I don't think it affected bonding at all.
No. It's all good. That's
not
great.
At all. So I heard, though, that you wrote something about kale in your book. Talk to me about kale.
Right. So it's actually kale is on the cover, which is kind of funny. So a couple things about kale. It's not a new substance that, people think that kale just came about a few years ago and it didn't exist before that. But it's the stuff like when you get those fruit platters for your party and there's that green junk that you usually throw out. That's kale, actually. You can eat that as long as it's clean. Probably not nowadays with COVID. But that's kale, and kale can cause some other issues with your thyroid function. So, there are people that eat kale like nobody's business. And, the other thing about something like kale, because it is very bulky, oftentimes people will put it into a smoothie. So you'll take like 6 pounds of kale and it comes into a little cup this big, but you're still eating 6 pounds of kale. It could mess up your thyroid function. So a lot of people, it's sort of like one of those mystery diagnoses that why is somebody having some issues with their thyroid, and then when you really dig a little deeper, it's not their thyroid itself, it's something in their diet. So it's it's one of those things that it's a good food. It's just like any other green vegetable. It's good for you. It has fiber, it has vitamins. You lose the fiber when you put it in a smoothie, just as you would lose the fiber with any fruit or vegetable that you put in a smoothie. But it's not the answer to all of your woes. And I think that's an example of hype where it's good for you. Have a kale salad, sure. But do you need to eat 6 pounds of kale? You don't. You don't need to eat 6 pounds of anything at any given time. So, I think it's one of those things that's just blown up into this, godlike substance that it is not.
Well, and basically, I once gave a talk called "Everything Your Mother Ever Told You Is True." Everything in moderation, including moderation. So one of the questions I get asked a lot, particularly about menopause, is the issue of, well, instead of taking estrogen, can't you just eat yams? And I say, yeah, but you'd have to eat about 75 pounds of yams a day to get as much estrogen as one tablet. So people want those kind of bargains, I think, from their physicians. Can't we do one from column A instead of 2 from column B? And most of the time in medicine, you have to do all of the above, for the best result.
Or you need less. So for instance, as opposed to taking 1,000 milligrams of vitamin C, you can have an orange and have vitamin C that way. And you don't need 1,000 milligrams of vitamin C anyway. You're going to pee it out. So sometimes a lot of these, pills or supplements are more than you need. So it's easier to just, eat a little bit of something healthy. So,
well, and the other thing is when I get questions about things like vitamin C, which I think people think is the cure for just about everything. I always say, well, who are we talking about and what are we talking about taking it for? So I think people also, in areas where we do have data about certain aspects of the use of vitamins, for example, they don't always understand the difference between using something for prevention versus something for treatment versus something in somebody who has a vitamin deficiency. Right. So if we're talking about somebody who has scurvy because they were, stranded on a boat in the middle of the ocean for 6 months and they had no vitamin C, obviously we're going to be talking about giving that person very high doses of vitamin C, probably for quite some time. Similarly, if we talk about things like iron, we're going to, there are many people who have iron deficiency anemia, which is extremely common. 25% of all menstruating women have iron deficiency anemia. We're going to recommend a very different dose of iron for them as for somebody who does not have anemia or somebody who's pregnant, for example.
Right. And isn't there's some iron vitamin C? Doesn't vitamin C potentiate the absorption of iron?
Yes, it increases the absorption of iron. And also vitamin C also increases the absorption of calcium. So, I don't know if you remember the calcium supplemented orange juice preparations. That's what, that's what that was about. Right. And of course, we know vitamin D increases the absorption of calcium, which is why a lot of milk preparations are fortified with vitamin D.
Right.
So, it's that whole knee bone is connected to the shin bone thing. Vitamin D is getting a lot of hype now. And in my opinion, not in terms of analyzing data. I mean, here's an example. In my opinion, it's very well-deserved hype. But if we actually crank down to the level of the data with respect to vitamin D and COVID, the data is not that specific. It's very general. So the data I've seen has looked at countries where the average vitamin D levels are low, tend to have higher COVID levels, but that doesn't look at individuals in those countries.
And it's an association, not a cause. It's not that not having vitamin D is going to cause you to get COVID. And also, and that vitamin D is not going to cure COVID either.
Well, it might, we just don't know.
So,
but that's the other thing. A lot of these things, could be good theories.
Yeah.
I don't want to dismiss any good ideas out of hand.
Right.
And many times I'll answer a question by saying, well, I don't know that, but I also don't know if anyone knows that.
Right.
I don't know, because I certainly haven't read here's true confessions live on In the Ladies Room with Dr. Donnica. I don't read every medical journal the day it comes out. And quite honestly, I don't read every medical journal. And quite honestly, I don't even read the table of contents of every medical journal. So I'm not aware of every study that's ever been published on any topic.
Right.
All I'm aware of is what has happened to come to my attention. And quite honestly, I don't think that's much different from most physicians.
Right. Yeah, I don't read every medical journal, that's for sure.
Right. So none of us can know everything. And any doctor who tells you they know everything is either somebody you're married to or somebody who's lying. Or both.
Better not be the same
person. All right. So tell me about your, I think there was something in the book about underwear. Did you have something in there about like what underwear to wear or the myths or hype about?
No, I think that's, are we talking about Gwyneth Paltrow now?
No, I'm always talking about Gwyneth.
There was a thing of just, there was a thing in the paper today that, one of her vagina candles exploded. Did you hear that?
In somebody's vagina?
That's what I was wondering. I was like, I cannot read this article. I just read the headline. It's too disturbing.
Well,
no.
I have often said that
room.
The two people who keep me the most busy in terms of media inquiries are Gwyneth Paltrow and, lumping all the Kardashians together, because I don't really know which one is which. But anytime a Kardashian tweets anything about her vagina, or anytime, Gwyneth Paltrow recommends a new vaginal product, I get a few phone calls and emails. Yeah. And that's unfortunate, because those people are really trying to hustle and make a buck. I remember years ago, there was somebody, not the two of them, somebody made a product that was a bra with some kind of insulfator in it. And it was supposed to make your breasts look a full cup size larger. And I said to the reporter, just out of curiosity, how much does this thing cost?
Right.
At that, this is many years ago, it was $750. So that's when $750 was really a lot of money. Yeah. And I said, how about this? How about they just go spend $30 at Victoria's Secret and get a Wonder Bra and look a full size bigger, immediately without doing all that. So what's up for you and your life and your career in the next phase?
So the next phase is, I love to write and I love to communicate. So if there's hype for adults, why can't there be hype for children? Right. So I have a book coming out next year. Well, I guess it'll be end of 2021, and it's not called Hype for Kids. I don't think any parent would buy it. And the title is still being tossed around, but it's going to be a book for middle grade kids, so 7 to 12-year-olds, about how for them to understand all of the things that parents are telling or caregivers are telling them to do, and what is the science behind it, and how can a 9 or a 10-year-old or a 7-year-old understand that. And I think what I'm curious to see is how many of the parents are going to learn something from it as well, because I think a lot of the information that's there, and it's just really teasing apart, what happens when you eat a cookie? What happens when you eat a piece of lettuce? What happens when you eat a hamburger? What happens when you get a shot? All these things that you can really tease apart and make sense for kids is something really important. And the goal is that when they grow up, they will not fall for all the nonsense that we all fall for.
That's awesome. And in fact, we've used the education of children to affect some very important public health initiatives. So I remember, I'm probably a little bit older than you, but I remember when I was a kid, there was a huge push to educate children about how bad smoking was.
I remember.
Not just so that we wouldn't smoke, but so that we would, take that information home to our parents.
Yeah.
And I used to steal my father's cigarettes and my aunt's cigarettes and flush them down the toilet because I was terrified about what was going to happen. And that got me in a lot of trouble.
Did you remember the Yule Brenner commercials? Do you remember Yule Brenner?
Yes.
And they only aired them after he died.
Mm-hmm.
From lung cancer, I think it was.
Yes, metastatic lung cancer.
And do you remember the Rubella umbrella?
I do, but I didn't remember it until you mentioned it.
That was, 60s, 70s.
Yeah.
And, I didn't really know what rubella was, but I remember the umbrella and they were holding it, and it was something that you did not want. You did not.
Well, and I used to collect money for the March of Dimes.
Right.
And the March of Dimes even came to our school, and they helped us open bank accounts with this March of Dimes passbook. And it was just a 2-page passbook, and it had slots for you to put dimes in. And then when you finished the dimes, you would take it to your bank and open a bank account with the March of Dimes.
Oh, that's cool.
Passbook. Cool. And I didn't know, I didn't remember that the March of Dimes was campaigning against birth defects, but I later learned in my later doctorhood that the March of Dimes actually began with a mass public education effort to vaccinate against polio.
Did not know that.
And that was, I guess, each vaccine was supposedly cost a dime or something, or for a dime for donation, you could vaccinate another child. And I just learned, actually from Twitter, that the phrase "a spoonful of sugar helps the medicine go down." Did you see that tweet? Oh, you did. My daughter says that all the time. I always tell her these things that she told me. But yeah, so how cool is that? A spoonful of sugar helps the medicine go down is based on the original polio vaccine.
You know how that came about?
I do not. So tell me.
So the guy who was writing the songs for Mary Poppins couldn't think of a song, needed one more song. And his kid went to school one day and came home from school. And the guy who was working on the song said, how was school today? And he said, fine, I got a polio vaccine. And he said, wow, did it hurt? And he said, no, they gave us a sugar cube and poured it on and we ate it. And that was the vaccine. And then he said, there's the song.
That's awesome. So now we have to look up who the composer was and the lyricist. Yeah. Because I should know that. But yeah, I love when Broadway and medicine kind of come together.
And, just then there was no parent consent. There was no dissent. There was no absent, I'm not getting a vaccine. It was just you show up and you got it at school. And I think that went even into the 70s and maybe even later, where you just got your vaccines at public school and it wasn't a question of can you get it or, signing a paper. I think everyone just got them.
Well, I just heard this phenomenal story that Rachel Maddow shared on her show about how in 1947, there was a guy who took a train from Mexico City to New York, and he felt progressively sicker on the train, got to New York, stayed in a hotel for 2 days, wound up at Columbia University ER, and was diagnosed with smallpox.
Mhm.
Within 1 week, the New York City Public Health Service Public Health Commissioner mobilized the troops, and they vaccinated 1 million people in 1 week in 1947 with no social media. And the only public announcements they did were over the radio. And the health commissioner himself got on and did the announcements on the radio. And they vaccinated people everywhere, at schools, at grocery stores. And she even pointed out they even went to the circus to vaccinate the circus workers. They vaccinated people where they are. So if they could do that in 1947, why can't we do that in 2021? And one of the reasons that I found when I went to I don't work in a hospital, so I got mine as an outpatient. So I got the Moderna vaccine because it doesn't have to be refrigerated as deep cold, a refrigeration process. And the process went very smoothly, but I was shocked in the 45 minutes that I was there, how few people they vaccinated in 45 minutes. And the reason was it took 15 minutes just to do the paperwork and to get all the sign-offs and all the ID and, make a copy of my medical license and make a copy of my driver's license and get my insurance information, when none of that should be necessary. It should be, are you sick today? Do you have a fever? Have you had COVID? No. Boom. Next person.
Or even if you had COVID, it doesn't matter.
Well, it matters if you've had COVID within the past 3 months.
Yeah.
So
although they're doing it, even
we
if
could make it Tuesday. I was actually concerned at the beginning of the rollout that we should be testing everybody with the rapid test when they come for the vaccine. Because I felt I was concerned that there would be a lot of people, and there have been some who have had COVID when they went to get vaccinated, didn't know it, then developed the signs and symptoms, 5 to 10 days later, and thought it was because of the vaccine.
Or even got the vaccine and then were exposed, got sick. Like there's enough time.
There's a timeline, right?
People who didn't have it when they got the first dose had Christmas dinner, and then 5 days after that got COVID. And they, they're in healthcare, so they did know that it was not from the vaccine, but they didn't have enough immunity, in those first week, the first week or two.
Yeah. So those are all issues that we're still going to have to deal with.
Well, they're starting these super pods. I'm sure they have them in New Jersey and New York. I know, like Javits Center.
The super centers. Yeah. Ours, we have them. That's the good news. The bad news is they have no vaccine to give out. So they're all set up. They're all ready to go. And nobody that I know of in New Jersey outside of hospitals actually has any supply left. So that's, and it's questionable whether they will have the supply to honor the appointments for people going back for their second shot. So that's a big crisis that still has to be resolved. So anyway, I could talk to you about this all day. I appreciate you coming, but before I let you go, I need to ask you what your most unique, interesting, unusual, or memorable experience was that you ever had in a ladies' room. And she's covering her face, folks, so this is going to be a good one.
No, this is PG.
Oh, bummer. We've had some that were not PG.
It's two things. Okay, because you have to remember, I'm in Los Angeles, so there's a lot of stardom and starstruck stuff here. But back in New York, I remember this. I was in line for the ladies' room. Does that count? Because it's
yes, of course, absolutely.
And there's this woman in front of me, and I look up like this because I'm vertically challenged. Can't tell from I'm not going to stand up. But this woman was this palatial woman, thin as can be. And it was at a Broadway show that I was in line, and I look up and it's this tall woman. It was Mary Tyler Moore.
Oh, wow.
Good one. That was a pretty good one.
That's a very good one.
The other one here in Los Angeles, which is even more whatever, it's close to home, but it's still, I'm a New Yorker, an East Coaster, so we don't get tired of this California, celebrity stuff. The people who grew up here, they don't care, but the people who are not from here, it's always a big deal. So we were waiting in line at a tiny restaurant in Santa Monica. And it was one of those restaurants where there's one restroom. It's not a ladies' room. There's one restroom. So you wait, and you wait till the door opens, and so out walks.
Call that a onesie.
Exactly. Yeah. So is it just the restroom, and out walks Helen Hunt.
Oh wow!
I mean, it's pretty good. So my mother, who was visiting us at the time, went up to Helen Hunt's table afterwards to make sure Helen Hunt knew that they peed in the same place.
And I'm sure that, I hope I remember that if Helen Hunt is ever a guest on this show, and I will remind her. But I actually have a Helen Hunt story. I was on an airplane once, and I was just getting my stuff organized. So I was facing the row behind me while I was getting all my papers together and whatever. And I saw Helen Hunt sitting in the seat behind me. And we made eye contact for a second, and she gave me this deer in the headlights look, like, please don't out me. Please don't tell anybody it's me. Please don't let anybody know. And I just kind of gave her a little smile and a nod. And then after we got off the plane, she just said to me, thank you.
Yeah. We leave them alone for the most part, except my mother, who decided.
Yeah, of course. And then my Mary Tyler Moore story, years and years ago, I was on the board of directors of the organization Research America, which is an umbrella organization that supports, increasing funding for and awareness about the importance of clinical research. And every year they have a big gala fundraiser thing. And it's black tie, and I was on my way to Washington for this event, traveling as I used to do in a very nice, but still a sweatsuit. It was navy blue velour sweatsuit and white sneakers. I get to DC, and there's like a quarter of an inch of snow. And in DC, when there's a quarter of an inch of snow predicted, the place goes crazy. So you can't get your own taxi in DC if there's a shortage. So they pile multiple people in, and multiple people get out. And I was the last one to get out of my taxi, and my suitcase was gone with my clothes for the event, which was now beginning in 20 minutes. And when I was about to burst into tears, I get an urgent phone call from the CEO of the organization saying our MC, who was Sam Donaldson, his flight was delayed. Can you fill in for him and be the MC of this event? And I just had a lipstick in my pocketbook, and I just put on lipstick, and I went to the event in my blue velour sweatsuit and white sneakers. And the first person I saw when I walked in was Mary Tyler Moore, who gave me the full once-over, raised one eyebrow, and said, I know there's a story to that outfit.
That's great. That's nice.
And yeah, there was. Anyway, it was lovely meeting you. Thank you so much for joining us in the ladies' room. Please get back in touch when the next book comes out.
I will.
And then you can talk to your publisher about doing a new edition of Hype and adding the COVID chapter.
Here's hoping. Yeah.
Take care. Thanks again.
All right. Thank you. Good to
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donnica. And please join us next week for another episode of In the Ladies' Room with Dr. Donnica. Real conversations with real women about really intimate topics.